In order to move beyond the pandemic, which is the subject of this conference, it is necessary to take a look back on the chances and challenges that arise from the pandemic for people with dementia. I would therefore like to share some results of the annual conference of the Austrian Dementia Strategy, which focused on these challenges and chances. The conference was held online, and we invited people living with dementia to talk about their experiences during the first period of the pandemic. Additionally, we asked relatives, self-help groups, and professional care providers to talk about the very same. This gave us an insight into the situation of people with dementia. I assume most of us are aware of the challenges people with dementia faced at the beginning of the pandemic, so I will only briefly summarize these reports and would like to conclude by talking about the positive aspects and also the opportunities for people with dementia. In the conversations, we learned that many people were able to cope well with the situation and the restrictions. The virus was not perceived as very threatening by many. However, the media reports sometimes triggered fear and insecurity. There was also some uncertainty in public spaces about the correct implementation of measures. People with advanced dementia often could not understand the situation and follow the measures properly. This often led to a lack of understanding in public spaces. For people in nursing homes, there was also the fact that families were no longer allowed to come into the house, and thus physical and mental decline was observed due to the absence of families. But now, away from the negative points. It was also reported to us that people with dementia noticed a certain kind of deceleration during the first lockdown. They were able to enjoy the peace and quiet, and their well-being benefited from not being under pressure to perform or to meet deadlines. It was also said that many had no problem with loneliness due to social distancing. Neighbors and families were very supportive, and many felt that they even received more attention during this time. Also, in the nursing homes, the staff had more time for the residents and could respond better to the needs of people with dementia, as long as there were no cases of illness, of course. One aspect that was mentioned by all participants is the possibilities that digital aids offer to people with dementia. Many people with mild dementia were able to discover new methods, such as online meetings, when supported. These had the advantage that strenuous journeys were no longer necessary, and in the area of self-help groups, people could be reached again who had actually already dropped out due to limited mobility. It was emphasized that these meetings cannot replace personal contacts, but that they do bring advantages as an additional offer. Many people and groups still use these tools today. So this is really just a brief overview of our conference, which does not claim to be complete, but unfortunately, it is all that can be done in 5 minutes. There is a German report of the event, which I will be happy to link you on the last slide. And I invite you to contact us if you have any questions. Thank you very much for your attention.